washing machine and dryer and stuff in here, and they use it. We use it to keep stuff clean around here. We do our own cleaning. And if you come over here, this is our shelf, our shoe rack. One of the things we do is, as an incentive to the employees, once they complete their probationary or introductory period, we'll purchase them a pair of tennis shoes as well as one of the uniforms. And these tennis shoes, current and past staff came up with the idea to do something that would be eye-catching to get the word out about HIV and AIDS. So if you look at our feet and you ask us what's on our shoe, that opens up the opportunity for us to have a conversation with you about HIV and AIDS. And they are very popular. So this is also where we keep some other condoms, what we may call our specialty condoms, like the glow in the dogs. We do have Trojans, and when we make condom packs, we put them in these bins and our storage cabinet. And on the refrigerator, we have to maintain the temperature of our tests. So everything is just not as simple as people sometimes think. Like, oh, it's just passing out condoms and trying to get people tested. One of the major goals of HIV services or HIV prevention services is to talk to people about changing their behaviors that put them at risk for getting HIV. So we have to be held accountable for our actions, our activities, what we're giving out, who we're serving, who we're testing, who we're doing outreach to, who's getting trained, who's certified, etc., etc. So this is serious business, and I ask my staff to take it serious. And I can say right now I do have a good staff that's working really hard. I mean, we joke and clown, but when it comes down to take care of business, we pretty much get it done. We've been doing this for over a decade, at least formally structured for 13 years now. So we feel we have a good idea of what needs to be done as far as prevention. We consider ourselves a good organization that is willing to adapt and adjust when changes are made, because you got to do it, especially when you're getting money from other folks. So we work hard. We really do. First and foremost, because we care about the community, the people, and talking about people's health and saving lives. We're here to provide a service and not pass judgment. People do things we may not agree with or believe in, or vice versa, but that's not the point of this service. This service is to basically teach you how to practice safer behaviors or reduce your risk of getting HIV or other STDs. So, what else? On the other end, we have my office, which I call the junk room. I'm not sure if you want to see that because there's so much to do. What's it saying? There's so much to do.
Phone number.
Oh, okay, I'm sorry. And ways to contact us. You can contact us. Our work phone number is 504-283-7376. Our fax number is 504-267-0195. Staff have business cards as well as email addresses and work cell phones that you can get in contact with them as well if needed. That's because we're dealing with an issue, and sometimes we're dealing with clients that are positive and we don't want them to use their personal phones. But since we have them, most definitely they can use them. So if you can't reach us at the office, because we do a lot of stuff in the field, you can get in contact with us or staff member directly using their email address or phone number or work cell phone number. My work cell phone number is 504-428-1975. We have a MySpace address, which is myspace.com/campacehiv. myspace.com/campacehiv. So if you want to come utilize our services, whether it's testing, free condoms, you can give us a call, 504-283-7376. If you see staff, you can talk to them about making arrangements. We also do HIV STD presentations at whatever venue, wherever it may be, that wants the services done. And all of our services are free, and we don't discriminate. There's no room for that in this business at this place. So whoever needs it, whoever wants to talk about it, if we have the time and staff to provide the service, we'll come over there and get it done. So that's kind of a summary of us, and we look forward to being in this field as long as it takes, and we're going to be here. So this is one faith-based organization, which is a church that you can count on in being in this HIV fight genuinely and wholeheartedly. So we're going to be here. We're not going anywhere. Katrina didn't wipe us out. Rita didn't wipe us out. Gustav didn't wipe us out. We plan to be here. So that's us kind of in a nutshell.
If I wake up on tomorrow, find that all of my loved ones are gone, look around and see that my friends are few, I'll still keep holding on. If I call and there's no answer, in the midst of my despair, I can still say, Lord, you've been good. You've been good. Oh, yeah. So as long as I live, I'll tell the world God is good, yeah. You've been real good to me. I'm so glad to say right now, God is good. And listen, if I never visit Paris and enjoy that midday sun, if I never sail the seven seas, oh, before my work down here is done, oh, if I never see the ruins of that city they call ancient Rome, I'm not worried because I can still